Happy Monday, everyone. Melissa Meiste here from Nephew Physical Therapy for Ask Melissa Almost Anything, where we talk about your life and your body, where we believe your health is your responsibility, that you have a choice in your health care, and most importantly, where pain is not normal. Like I said, I'm Melissa, your host. Today we are talking about elbows. I would say elbows are almost the forgotten joint because when we think about the elbows, a lot of times they don't give us much pain unless we're dealing with golfers or tennis elbows. Let me tell you this, you do not have to play tennis to get tennis elbow. Tennis elbow is one of those things, if you've experienced it, it is highly debilitating. We can quickly diagnose it as physical therapists because it is irritated by palm down grasping or gripping, point tenderness right here at the elbow, and it often comes with a really, really bad posture. And so what you can see with somebody with tennis elbow, it will bother you with a variety of different activities. I have suffered from tennis elbow that has bothered me at different times during my volleyball time. And so when I am passing, right, or hitting, that force that gets transferred from the shoulder is affected at the elbow. Once upon a time, I had a patient who had horrible tennis elbow. And his was flared up because he spent probably a very, very long day cutting wood. And so when he came to us, again, point tenderness here at the elbow, painful to the touch, grasping and gripping were painful. So as physical therapists, real life happening here, folks. As a physical therapist, we like to get our hands on people. And so if in fact you are having some elbow issues, the first thing we like to do is do some massage. So we get into there. Can I tell you that I bruised myself once? As tennis elbow has come and gone with me over the years, I remember rubbing it at church so bad that I bruised myself. And you'll bruised it, not just because maybe you actually see some bruising, but it will feel very puffy to the touch. So I rubbed it down really good during church one week. Yeah, not so good. A little bit too much. But that local massage and local icing addresses the attachment. But back to my former client. So we did some manual therapy. But the thing that probably was the most successful, because very rarely do we actually see an elbow resolve this quickly, but it's possible. In just 4 visits, he had no more pain in his elbow. Why is that? We strengthened his rotator cuff. Now, commonly called the rotor cuff. The rotator cuff is 4 muscles that creates a circular cuff right here around the shoulder. And to strengthen that, we need to do shoulder activities. It's connected to posture. But here, let me try to show you here why the shoulder has such an impact on the elbow. It's a little hard with a horizontal screen, but I'm going to do my best. When I have horrible posture, I look like this, right? Now my head might careen a little bit more forward, right? Nice rounded back. Not nice, horrible, right? Well, what happens, and this is the difficult thing to relay here on the screen, is stand there, arms at your side with your shoulders back, right? So I'm standing here, arms at my side. What you would see is my thumbs are facing forward, right? Do you feel that? Arms are at your side. Now, feel what happens when I allow my shoulders to roll forward and in, which this is probably more like my standing resting posture. What you'll notice is your thumbs are facing inward at a 45-degree angle. No longer here, but here, okay? And the only thing that I have changed is my shoulder/shoulder blade position, right? When I'm here, I'm forward. When I'm here, I've engaged the shoulder blades. I actually haven't worked the shoulder that much yet, okay? It's shoulder blade, the muscles between your back, right here in the middle. What it does is feel that change then in the resting position, the starting position of the elbows. So again, talking about a client here who had created a lot of tennis elbow from cutting wood, right? Not playing tennis. that point tenderness right here. You can feel it a lot of times along the back of that forearm, right up to that elbow joint, pushing right there. Okay. What we did is we worked on strengthening external rotation. All right. So again, we're talking about elbows today. And if you have a question, please put them in the chat. But what we want to keep in mind is while we have elbow pain, we are always looking for the cause. We're getting to the root of the issue. And the root of most elbow overuse injuries, unless you fall and break it, overuse injuries is going to be due to a bigger muscle group failing to provide support. So think about this: large, medium, small, extra small, right? Most people's arms taper down to their hands. We don't have big, bulky hands and little bitty, itty bitty, skinny shoulders. Large, medium, small, extra small. Based on the size of the muscles, it lets us know the function and purpose of that muscle. The larger the muscle, the stronger it's supposed to be, the more stability it provides. The smaller the muscle, the more mobility and motion it provides. So when we start to come down the arm, the farther away we go, again, we're not talking about neck issues necessarily today where we have numbness and tingling, deep aching pain, burning pain that's adjusted or changed by neck position. We're talking about overuse injuries of the elbow where we take these small muscles and we put them to too much work because, oh wait, the large muscles have decided to stop working because, oh yeah, gravity's winning. We're sitting at our desk too much. We're not upright. We're not strengthening. We're not doing those things. That's what we need to do. And in this particular gentleman's situation, I honestly have never seen anything like it. Got better so quickly. In just 4 visits, we were able to make his pain go away. But what we need to take from that is he needed to strengthen. Just yesterday at my son's birthday party, same question from a friend. This time, due to fishing. So my elbow hurts here, right here at the spot. I got this muscle here, comes right up. Same story, same song, different sport, different activity, that same thing. What stretches or what can I do to make it feel better? This is always the question. And honestly, most people ask for what stretches. Okay, I will give you the stretch because everybody asks for it. Okay, here is the stretch. If you are tender along the back of your forearm, what you will do is you will put your arm straight in front of you, not bent, straight. You will make a loose fist and you will apply pressure to the back of that. Good stretching, proper stretching is uncomfortable but not painful. Okay, so keep that in mind. Good stretching, proper stretching is uncomfortable but not painful. So if it hurts and you're grimacing, you're doing it too hard, okay? Nobody's forcing you to push it that hard. The harder you push it, it will not get better faster. Keep that in mind too, folks, okay? This is not where no pain, no gain applies. That's not what we're talking about. So we're going to apply that stretch. Stretching at least 30 seconds, which will feel like forever. So I highly recommend you use a timer because you'll feel like you're here for 30 minutes. There is some neurological reasons why we do a minimum of 30 seconds. I like upwards of a minute if you're actually trying to gain flexibility. But at this point, what's happened from a general perspective is tennis elbow, which is a tendinitis of the extensors, the muscles that extend the wrist, right here, right just above the elbow, is causing that tendon to tug and pull off the bone, okay? And so it's creating inflammation, tendinitis, meaning inflammation of the tendon attachment. And whenever you bring 2 different structures together, if you've heard me explain this before, you took 2 boards and nailed them together at a corner, okay? And you applied pressure, where are they going to separate? They're going to break where that transition of material is, okay? I'm going to apply that pressure. It's not going to break in the middle of the board. It's going to break where we nailed them together. And so because the tendon is transitioning into bone, that's going to be one of those transition spots. So when you apply extra amounts of pressure through the muscle, which then it attaches to the bone by the tendon, oftentimes you're going to see it irritated right at this point. What goes with that, though, folks, is you've got this repetitive use of the muscle, okay? Because that tendon is what just transfers that that stress or that pull from the muscle to the bone. Because it's got to attach somewhere. If the muscle doesn't attach, it doesn't move anything. So we've got lots of tightness happening here because the muscle is actually what's getting overused. It just translates into a shortened muscle. Well, where's it going to pull? It's going to start pulling up here at the end. Okay, you're going to get that tugging in that motion. So yes, you can start stretching out that muscle. But if you go back to the posture, to this scenario right here where we're forward, again, think about your thumb position. When you have proper posture, your thumbs should point straight forward. If they don't, or they don't do it equally, that will also let you know which side is weaker. So if I stand here just relaxed and look down, it's not good. My thumbs are turned in, okay, instead of turned out. Why does that matter to how the elbow functions? Okay, 2 points here. One, again, we're talking about the rotator cuff and shoulder blades, where we pull this kind of back, right? We're holding from there to get that neutral position. Also, what happens then, so if you think about this, I'm turned in. To go to use my arm, my muscles now have to move me 30 to 45 degrees just to get to neutral and then go, and then do its normal job. So now I've picked up that much motion. Again, it could be, if you're really turned in, 90 degrees, right down to 15, 20, 30 degrees, whatever we're at. That muscle here now has to get you to neutral, and then we get to engage because the shoulder decided to stop working for that initiation of motion. So we're going to overuse that, okay? So again, when we're talking about the elbow, we need strong rotator cuff, strong between the shoulder blades, and if we can't build strength there, it often indicates that we're tight here in our chest, okay? And so that's where we have to open up the chest. Good chest stretching. We love to do a good foam roller stretch where we're laying on it from head to tail, opening up that chest and letting gravity do that where we're laying on our back. And then follow that up with things like shoulder retraction, shoulder blade squeezes, $5 foot longs where we're doing some bands where we're pulling out. But my favorite is, imagine I'm laying on my side and I'm doing this motion here, engaging through the shoulder and the shoulder blade. Now, while these exercises seem easy, there is a reason why you want a good, no, I take that back, an excellent physical therapist to guide you through that process. If you're a physical therapist, if you're not in West Michigan, all right, I'll forgive you for not coming to Nephew. But if you are in our backyard, the reason you want to choose our therapists is because they're picky. Because they will not let you just do the exercises. This is quality. Oh, I almost said that wrong, didn't I? Quality over quantity. If you're doing these exercises correctly, whether we're talking about $5 foot longs, whether we're talking about wall push-ups, or that sideline external rotation, paying attention to where the muscles are hurting and aching is our job to make sure that we're getting the right thing, that you're not cheating with your neck, that you are not cheating with your biceps, doing all those different things. And so that's really important. So keep that in mind. And that's the reason why we should be seeing a skilled physical therapist to guide you through that. And we get to put our hands on you, friends. Like, that's what we love to do. So it's a combination of good massage, good icing. If you're not icing that tendon, you should be. And then proper retraining of all the muscles that support that. So Amy has a question here in the chat. Can you explain why they no longer recommend steroid injections for tennis elbow? Well, I can't specifically do that because I don't do steroid injections, Amy. I will say this, and this goes back a long time ago to my training, is when we start injecting joints, there really is a limit to how much steroids that tendon or ligament can hold up to before that tendon will start breaking down. Now, again, I'm not a doctor doing those injections. I know that sometimes we do that point tenderness to calm down inflammation. So in the case of a shoulder, often an injection is done there to see if we can calm down all that inflammation so we can rehab that shoulder without jumping all the way to rotator cuff surgery. So that kind of risk, cost, benefit analysis can be worth it because rotator cuff surgery is a big, hairy deal. It's not just the surgery. The recovery is 3 months. It takes a lot of therapy, a lot of patience, a lot of pain to get through all that. And so it's worth trying an injection. The challenge with the elbow is the surgical option is not great. We're talking about a tendonitis, which doesn't necessarily mean a complete tear. It's usually just a lot of inflammation where it's attaching to that bone. And so those steroid injections, from my perspective, only prolong getting to the root of the issue. And while it's great to manage that pain and calm it down, if we're not, like I said, getting to that root of the issue, where is the weakness? Where is the tightness? Why are we overusing the elbow? Yes, some of that's body mechanics, okay? So some industries that are, you're using a hammer all day, construction and building and all that kind of stuff, yes, you're at greater risk because you're doing strong grasping and gripping with motion all day long. That does push you at a greater risk, which makes it even more important that your activity level outside of your job is really important. So from a big picture perspective, and I was thinking about this yesterday, as I was just thinking about, okay, do we talk about the elbow in regards to my leaky ceilings scenario, if you've heard that one, or the shaking? I'm sorry, did I say steering wheel? Now I'm combining my stories. Leaky roof with a stained ceiling tile, or the scenario where I talk about the shaking steering wheel and nobody replaces their steering wheels. When we talk about the investments in our vehicles and our houses, that's quite a bit of an expense. I mean, brand new trucks now, what, $70,000, $80,000, $90,000? Our houses, $200,000, $300,000, $400,000, $500,000 or more. These are some of the biggest investments, financial investments we make throughout our entire lives. And when something goes wrong, again, we think that there's a roof leak because we have a water stain on the ceiling tile. We jump on that pretty quickly, right? We're calling the roofing company, or we're trying to figure out, why am I getting that water stain? Because everybody is nervous that they might have a leaky roof or something not working right in their home. We fix that, because why wouldn't we spend $5,000 or $10,000 on our $200,000, $300,000, $400,000, $500,000 investment? Because it makes sense. On our cars, when things aren't going right and they're not running well, we do regular tune-ups. We do oil changes. My steering wheel starts shaking there. I'm checking the alignment because I don't want the whole thing to be unbalanced, because if I'm going 70 miles an hour and I feel like the wheels are going to fall off, I don't feel safe. So I take that in and get that checked. Again, those repairs can run $500, $1,000 or more to keep my car running well. Why do we do that? Because we want it to last. We want our vehicles to last. That's why we wash them or wax them or detail them. That's why we do all these things. We take care of our homes. We don't let trash pile up on the floor because we know it will weaken the floorboards. It'll do any of those kind of things. The question is, why are we not spending more time, effort, and energy on our bodies? And as I say that, I am totally talking to myself. I very much will spend money on all the car maintenance. I'm about to put a brand new kitchen in our house. We're making investments on better windows, better efficiency. We put in a new furnace. The first thing we did when we bought our house was buy a new furnace. It's not fun. It's not pretty. It's not new paint or furniture or flooring, but it was a good chunk of change to put in something that kept us cool and warm and kept the house dry, right? We had water leaking in. We put in piping. We put in gutters. We did all these things, right? Because nobody wants water in the house. Nobody wants damage. We know those things. But the question is, why don't we do a better job of how we take care of our bodies? Because our body, we get one of these. This is the only one we get. You can get a new house. You can get a new car. You can get a new bicycle. We can get new ones, right? Those things can all be replaced. But we can't replace this. Can't replace your elbow. Can't replace your neck. And yet, when it comes to where we budget our money, we budget our energy, we budget our time, I'm guilty. It's one of the last things that we do. I might squeeze a walk in at the end of the day. I might only address my posture when I hurt. But if I'm not investing in myself regularly, daily, over time, at some point, right, something's going to go wrong. Yes, on our homes, eventually we have to replace the roof. We know that. But we can't do much more. But there are things along the way to extend the life of the roof, right? My husband gets up there and blows off the leaves. We look for leaks. You know, if a windstorm comes in, right, replace the small things. We make those investments over time. Making investments in our body is so important. And I think that the elbow is such a good example of when that starts to hurt, it is letting us know most likely that we have neglected some part of our physical health and our posture. Now, posture again is that word that we've said too many times. Again, the word that makes us all stand straight up at attention. Except it requires so much more. Posture is so much more than standing up straight. It is about flexibility. It is about strength. And that's where spending that time and that investment in stretching, modification of our activities, all those things. So what I want to end our session with today is I am going to give you my top tips, okay? The things you need to be doing to prevent it. That being said, if you need a coach, if you need a guide, that's what we're here for. If I knew how to fix, the roof in my house, I would just fix it. I don't know how to do that. If I have a plumbing issue that we can't fix with a plunger, do you think I'm just going to start taking things apart to fix it? No, because I don't want to do more damage. I don't want to delay the problem, right? Because it's no fun when you can't use your plumbing system or your septic field backs up or whatever, right? I mean, I know people who've had sewer systems back up into their basements. Nobody I know wants that problem. So how do we stop those things from happening? We ask for help earlier. And again, we can all still be friends. You don't have to come to Nephew Physical Therapy for your aches and pains. That's okay. We can still be friends. But I wouldn't be doing my job, which, let's be honest, is more of a mission of telling people that pain is not normal, that your body was made for so much more than you're capable of doing. Chad Wright, one of these great former Navy SEALs, says, don't give pain a voice. Well, I say that's true, that we can always do more than we should, but give us the pain, let me say this right. Tell us, voice your pain to us so we can make it go away so you can do whatever's next. That your body can do so much more than we think that it can. All right, so in closing, we're going to talk about my top tips. First thing is you need an egg timer. You need a timer on your phone, something in your house, in your office. We need to be getting up and moving more. It's the most simple thing we can do to modify our activity. If you have a standing desk, we've now put one in my office. The front desk now has one. Give everybody a chance to change positions. You should be doing it every 30 to 60 minutes. Melissa, you should be doing that every 30 to 60 minutes because you ever get in the middle of a project and you're just sitting and you're typing away and you're thinking, and before you know it, 2 hours have gone by and you haven't drank water or gone to the bathroom or moved. Yeah, that's when things start hurting and go numb. All right, so first tip, timer. Second tip, stretch. Oh, the glorious foam roller stretch. We've talked about this many times through Shelter in Place and here on the Ask Melissa Almost Anythings. Again, this is where you take that foam roller. I recommend a full one. If you don't have that, a pool noodle works. Or you can take 4 or 5 bath towels and roll them up. The key to this is you're going to take that cylinder, whatever you choose to use, and you're going to lay on it from head to tail. Okay? So it's laying right along your spine. Make sure that your head is supported. Don't let it fall off the edge of that foam roller. It will feel horrible. Your knees are bent. Your feet are flat on the floor. Arms are resting out at the side, resting on the floor. You're just there all lined up. You lay there. It is truly the easiest exercise we ask anybody to do. 4 or 5 minutes. We really, again, preaching to the choir, we should be doing this every day because gravity is always pulling us forward. We spend too much time in our cars, too much time on our computers, too much time on our phones. Laying on that 4 or 5 minutes a day will open everything up and it feels amazing. Every time I demonstrate it to a client, I'm like, okay, I'm just gonna lay here for a little bit longer because it just opens things up. It allows my spine to mobilize and move. Feels so, so very good. The other stretch, if you are having acute, more recent elbow pain, is going to be this stretch. The back of the forearm stretch with that gentle overpressure, holding it for 30 to 60 seconds. You can go back and forth. You can do both arms. That's totally fine. But you're going to hold that. I don't like this stretch at all, but we're not talking about the front of the forearm today. We're talking about all these are the stretches. If you're going to stretch your forearm, fingers always to the floor. This will get the back of the forearm. If you want to do the front, same position, okay? But you need that elbow straight to really lengthen those muscles based on their anatomical position. All right, so we've got changing positions. We've got stretching. Don't forget ice, all right? Ice massage right here at that elbow. If you're going to use an ice cup, that's a 4 to 5 minute direct ice on the skin, okay? It's going to be cold, burning, aching, and then it will go numb. Do not exercise or decide to pick up a whole bunch of things in the yard or cut wood or go golfing or whatever. If you've iced down, make sure your normal sensation returns when you do that. Last, but certainly not least, and probably most important, is going to be the strengthening. The strengthening aspect to re-engage the muscles that hold the shoulder blades back and your rotator cuff. Two simple things to get started out. One is going to be your wall push-ups. All right, this is where your hands are on the wall and you're going to allow those shoulder blades to squeeze back. Can you see this here, friends? I am going forward and back. What I'm not doing is shrugging. I am pulling those shoulder blades back and back out. We don't start with a full push-up because it's too much. You'll cheat. You've got to make sure that those shoulder blades are moving, and that's the important part of that. Okay, we're doing those. Lastly is going to be the external rotation of the shoulder. My favorite, when that elbow is irritated, again, I'm laying on my side, my elbow is pinned to my side at a 90-degree angle, and I've got a small weight. Believe me, friends, you want a small weight, 1 to 2 pounds. You're like, 1 to 2 pounds. I've had a client who could bench press 400 or 500 pounds, like ridiculous amounts of weight. Wait for it. Couldn't do 5 pounds in that motion. I'm telling you, it's one of the most neglected muscle groups that there is. So you're starting with 1 or 2 pounds of resistance. That might even be too much because when we're doing this motion, as with everything, it doesn't make the elbow feel worse. We're working on strengthening. If you do that exercise correctly, I'm laying down on my side, head supported by a pillow. If I do that right, you know where it's going to hurt? Right here. And hurt's a relative term. It's going to feel tight and tired, okay? This is where the rotator cuff refers to. It's right here in the middle of that arm. So if you're doing that correctly, you're going to feel it kind of pinch and grab right here. Do I think you should do both sides? Absolutely, even if you're only having pain on one elbow, because obviously we want upright posture on both sides. Okay, so you're rolling from one side to the other. That's your traditional 3 sets of 10, 3 sets of 12. But when you get to that last one, if you can't do it with the weight, you ditch the weight and you get those reps in, because it's all about engaging that shoulder blade, pulling it back as I rotate the arm out. Okay, so make sure you're taking adequate rest breaks, movement breaks, I should say, throughout the day. Don't stay in one position too long. You can do your chest and forearm stretching, super important. You have icing of the elbow. And lastly, and most importantly, you're going to be strengthening those shoulder blades, strengthening that rotator cuff so that we can return those thumbs to that straightforward position when we're standing. If your thumbs are rolling in, it's a good sign you're overusing that elbow. Thanks again, everybody, for joining us today in regards to your elbow strains and pains, knowing that you don't have to play tennis or golf just to have a golfer's elbow or tennis elbow. If you have any further questions, feel free to leave them in the comments. Thanks for following along. And remember, pain is not normal. Do something about it.